Fear House, where CS Health, that is Mutai Kagwe, is having a press briefing.
Arena. $154,828 people have died of coronavirus. Fortunately, 581,182 have recovered. As we continue to fight against this disease, I want to emphasize the issues that I have said, including hygiene, washing your hands, and all the other practices that we have said. But I also want to add and emphasize the importance of nutrition, hydration, and physical activity. The experience we are having is that nutrition, hydration, and physical activity increase our immunity, and therefore people are able to overcome the disease better. Consumption of a healthy diet and engaging in regular physical activities helps to strengthen our immune systems, lower the risk of chronic illness and infectious diseases, and also speed up recovery from illnesses. While on this, I must say that we have noted with serious concern about the non-factual food and nutrition information going around on social media on the healing effects of certain foods or drinks. This is not the time to confuse our people or to engage in publicity theatrics. While we encourage acts of charity, we advise Kenyans to get factual public health information from credible sources, such as professional healthcare providers, the Ministry of Health, and the World Health Organization websites. Fellow Kenyans, the extraordinary times we are living in demand extraordinary sacrifices, understanding and awareness from each and every one of us. Our common heritage as a people is under immense threat, and our limits as a society is being tested to its core. I have said this before, that this is the time for all of us to fight from the same side. If we do not do that, this virus will get the better of us. The measures we have so far put in place, which include the targeted mass testing, offer an opportunity to effectively fight this war. And if we fight together, not against each other. To our brothers and sisters in quarantine and isolation centers, we know what you are going through. Most of you have kept the promise, except for a few who have wavered. Everybody is being called upon to make a little sacrifice. It is much better to be counted as among those who helped keep COVID-19 at bay than to be counted as the inconsiderate few who have failed to appreciate the danger that this pandemic presents. What is required is a little bit more patience, sacrifice, and understanding from you, your families, friends, and Kenyans at large. We are also aware that within the same institutions, a number of people are going to the extent of offering bribes to get out of quarantine facilities. This is wrong. I am aware, for example, that in the county of Mandela, there are people, and this has been confirmed to me by the governor, that there are people who bribed their way out of quarantine. Both those who did that and those who let them off we will face the full force of the law. We are aware that there has been administrative lapses which have been raised. We have listened and we have heard. The National Emergency Response Committee is fully appraised and is responding to those concerns. There is room for improvement in management of quarantine facilities to ensure that the sacrifices being made are meaningful. We have issued the requisite directives, and we shall be moving around to ensure that every concern raised is addressed, and your role in containing this virus is acknowledged and appreciated accordingly. On a related matter, I have said time and again that the public needs to be alert to the proliferation of fake news on COVID-19 virus. We have also noted that there are people who are not complying with the movement restrictions in and out of counties and even from neighboring countries. On this, I want to caution truck drivers who I'm informed are smuggling people from one restricted area to another. I want to tell such irresponsible persons that they are rolling back our efforts to fight this disease. The enforcement agencies are there to deal with these issues, not to become participants in it. I am informed, for example, and this illustrates exactly what we are saying. The governor of Homa Bay informed me this morning of a group of people who traveled from Nairobi in a vehicle, in a private vehicle, pretending that they were attending a funeral, fully equipped with an empty coffin to illustrate that indeed that they were mourners. Those people traveled all the way from Nairobi during this period when we have stopped movement from Nairobi. They managed to come from Nairobi, traveled all the way to Homa Bay, and thanks to the Homa Bay Authority, Governor's Authority, and administration, somebody got suspicious. And on opening the coffin, obviously found out what I am now informing you. They were immediately put in quarantine, and today I can confirm that the driver is positive. This is what we are talking about. This person has now taken the disease to Homa Bay, where we have now tested the first positive case in Homa Bay. Ladies and gentlemen, this is what I am telling Kenyans, that until and unless we become self-disciplined, this disease is going to finish us. Somebody has now exported the disease to Homa Bay. Why? For very selfish reasons. I am even told that in the vehicle are some very respectable individuals. So I just want to reiterate once again the importance of maintaining the values that we are trying to impact in people, including social distancing when using public transport. Again here, ladies and gentlemen, fellow Kenyans, I am informed that there are people transporting even in matatus into and out of the city. And once they get to a roadblock, they pay and come round the roadblock and walk and are taken again by an empty vehicle or otherwise. In other words, transporters are organizing themselves to pick at each point where there is a roadblock. I am also informed that there are individuals who now have decided that if you come from Nairobi and they know that you came from Nairobi, Then they call the authorities and let them know instantly. I want to applaud those people. I want to say that if we all participated, if you inform the police, when you know that there is a person who is not supposed to be there, who is there, then we will handle this disease better. I am not trying to incite Kenyans against each other, but I am trying to say that information about a person who you know very well was in Kisumu or Nyeri or Mombasa, and you know that they are now in Nairobi and they are not supposed to be here, please inform the police, inform the authorities, because that person may very well be your killer. Fellow Kenyans, this is not a time for cat and mouse games. And going forward, what the people who are modeling for us are telling us is that depending on the level of discipline, that the results for this country, the number of people who will die in this country, or the number of people who will not die in this country, will depend purely on the level of discipline that we exhibit going forward. There are models that say that we could lose as many as 28,000 Kenyans dead as a result of this disease, unless we start observing certain measures and ensuring that we do social distancing and every other measure that we have been told. So, fellow Kenyans, Kenya is on red alert. The numbers are rising steadily. In the last 24 hours, we have doubled our testing capacity to test 1,115 samples. Out of these, 16 have tested positive for the coronavirus disease. We are now 262, the number of confirmed cases in our country. By now, you'll have noticed that the higher the samples, the higher the number of cases. This speaks both to the urgency to test Kenyans in the targeted areas I have said, and for every Kenyan to assume that the person next to you is a contact who could be carrying the disease. 15 of these cases who have tested positive are Kenyans and 1 is a foreigner. 12 male and 4 female. None of those has a history of travel, and none of those cases are in our quarantine centers. 9 from Nairobi, 5 from Mombasa, and as I said, 1 from Homa Bay County, each between 23 and 84 years old. And I can also add here that the 84 years old was a person who also believed in treating people via herbal medicines, herbalist. I'm delighted to announce also that we have 7 people discharged today, bringing the number of recoveries to 60. And I want to thank our healthcare workers, those who have been taking care of these people. I want to thank the doctors, the nurses, because it is through your effort that those 60 people can now join their families. But at the same time, I am also sad to say we have lost an additional 2 more patients, bringing the number of those dead to 12. And I want to send our condolences to the families of the 2 victims. In terms of distribution of age now, we know that there are 8 people who are aged between 0 and 14 years. there are 70 people between the ages of 15 and 29. There are 164 people between the ages of 30 and 59, and we have 20 who are above 60. Ladies and gentlemen, to bring this matter home closer to those of us who live in Nairobi, let me emphasize this, that there is no estate now that doesn't have an individual around you who may well be positive. For example, and these are just pure examples, in the Kilimani area, there are 6 cases in the Kilimani area. We have 3 we have picked from the Kawangware area. Karen has 5 people. Pipeline Estate has 5 individuals. Utawala has 4. Mulolongo, we got somebody. As you know, in Sili, there was an imam who was preaching and who was going to various houses, has died of COVID. So what we are saying in a nutshell, ladies and gentlemen, is that there is no place that is not affected. If you go to Buruburu, we have got cases in Buruburu, we have got cases in Utawala, we have got cases in Tasia, we have got cases in Parklands, and so we have got a case in Donholm, Hurlingham, Madaraka, and others also who are on the list. Gara, we had 2 cases in Gara, and the 2 cases in Gara presented themselves to a clinic and are positive. So because of this, we are also advising all health workers, whether you work in a private farm, in a private clinic, whether you work in a government clinic, whether you are the receptionist or whether you are the askari in that health facility, because you do not know whether the next person who walks in there will be a positive case, please protect yourself all the time. Ensure you are wearing a mask. Under no circumstance should you receive a patient without the necessary protection. And protection is now available. PPEs are available, as we have said. So I want to plead to all of us to take measures that we have announced seriously. Let's take what we are saying seriously, because what I do know is that if we do so, we can be a perfect example of a people living in harmony and a people who have defeated what others in the world have been unable to defeat. We can overcome, fellow Kenyans, we can overcome this disease. We can beat it, but only if we appreciate this is not a government disease. This is your disease, and this is my disease. If we appreciate that, then we can and should overcome. Thank you very much. I don't even have a pen. Can I? Just give me that.
Concerning 2 suspected cases, and we are informed that they have so who are these people, how did the test turn out, and what is the government plan?
Well, first and foremost, I think that the information that you get from anywhere can only be confirmed here by the Ministry of Health. So if you have any other information, then I'm not aware of that one. Next. Yes, Steve.
According to your speech, it appears there is need for hygienic mass testing. When is this going to start for Kenyans, and what is the matrix in terms of how we are going to
Thank you very much. Yes, the last one.
My name is Kennedy Muredi from NTV. There is the question of Kenyans who are outside the country and probably in Beijing or in the Chinese countries, and some of them we've seen are even in the streets because they do not, or nobody is attending to them. Is the Kenyan government willing to evacuate such Kenyans? Because we've actually even seen a tweet saying that they will be evacuated at their own cost. How is this going to happen, or is the government actually even looking into it because they are on the streets? Then the other question is, the other day you showed us a mask with Kenyan colors and you said that it is going for 5 shillings. You did not answer the question on where Kenyans can actually get this mask. It's a question that has been coming to our newsrooms. How are Kenyans going to get these masks at 5 shillings?
The last one.
So we got information that Mathare Hospital discharged patients who were yet to get well in the spirit of decongesting and keeping them safe. But how are they going to get essential services? And right now we are told they are at most at risk because they tend to relapse when there is such scare and sorrow.
Thank you very much. First of all, I am not aware of such information. If the doctor is aware, he will respond to that. Kenyans outside, we are discussing this matter, and in fact it was the subject of a discussion only yesterday between ourselves and the Ministry of Foreign Affairs, and the government will take certain measures. We are discussing it. We have not actually arrived at any conclusion at the moment, essentially because of the state of affairs. You know, there are no flights going in and out. If it's a question of evacuation, it's which countries do you evacuate from? Which ones do you leave out? There are all these questions to be answered. On the issue of the mask, the 5-bob mask, well, I am actually told that the price is now 20 shillings. So you'll have to buy it at 20 shillings. You should have bought it when it was 5-bob. If you see me closely, see me, there are 2 costs of price of masks, I'm told now. One of them is, you know, there is market testing. There's something called market testing. You sell something cheaply. When people get to buying it, you increase the price. It's called marketing. Now, there are now, I believe, 20 bob. You can buy a mask for 20 shillings. And we know that we are mass producing them at 20 shillings. There are also more expensive masks. The reusable ones, I'm told, are about 50 bob, but you can use it for a long time, going forward. The stringent measures that we can take, Steve, you know, I don't know why people would want the government to tell them what to do to save themselves. Because, Steve, we have told people don't live out of Nairobi, stay in Nairobi. Do we have people going out of Nairobi? Yes. We are telling people stay at home. If you stay at home, you will not pass this disease to anybody else, and nobody else can pass it to you. So even when people say lockdown, if you are so keen on locking down, why don't you lock yourself down first? Because there is no reason why you can't lock yourself down. You know, why does it have to be Mutahi Kagwe to lock you down? Or President Uhuru Kenyatta? You can lock yourself. So it's very difficult, Steve, to understand some of these measures. But as for the tests, we are indeed, we have started the testing. That's why we see us at over 1,000 today. We have never hit 1,000 before. So we are scaling it up as every day you have more and more. And the targeting means simply that, for instance, in an area like Isili, where now we are seeing little pockets growing, you might hit Isili. Instead of just going to the streets and going anywhere else, go to Isili, test Isili. We have now started Mombasa, KPA. It's an ongoing exercise as we speak. So it is targeted mass testing, and it has been increased, and the capacity is there now. So thank you all very much.
CS for Health, Mutai Kagwe, rating us on the number of people that have tested positive when you talk about coronavirus pandemic in Kenya. And in the past 24 hours, 1,115 people have been tested and 16 have tested positive. Now, from the 16, 12 are male and 4 are female. And from the 16 that have tested positive in the past 24 hours, 15 are Kenyans and 1 is a foreigner. So the total number of people in the country that have tested positive is 262. Good news is that we've had 7 people who have recovered, which brings the total to 60 people who have recovered. And unfortunately, 2 people have died from this, bringing the total number of deaths to 12. Of course, we send our condolences to the families that have been affected. The CS for Health, Mutai Kagwe, saying that the higher the number of samples that they've tested, of course, the higher the number of cases that have tested positive. He say that Nairobi now is an area that people should be worried of, and most estates in Nairobi, rather, we've had lots of people testing positive. Of course, giving an example of Kilimani, Kawangware, Karen, Pipeline, Utawala, Mlolongo, Isli, Parklands, Don Home, Madaraka, Hurlingham, Ngara, among others. So those are some of the estates in Nairobi where people have tested positive. Of course, the CS for Health, Mutai Kagwe, is saying that people should stay safe during this time of the coronavirus. Of course, that is where we bring it to an end right here on Scholar. And my name is Robinson Okenya, but I will also be joining you tomorrow from 2 to 3 p.m., bringing you some of the best and memorable moments in the world of rugby. Also, Roger Sishtemi, Ronaldo Koth, and Steve Ayo will be joining me to give me the best 11 of the Kenya Premier League before it came to an end. Enjoy the rest of your viewing. My name is Robinson Okenya. See you tomorrow.